Artificial intelligence (AI) has the potential to complement and enhance clinical decision-making, but whether it can consistently make better decisions than humans is a complex question. AI algorithms can analyze vast amounts of data, detect patterns, and generate predictions, which can be valuable in healthcare settings. However, there are several factors to consider. Data availability and quality. AI systems require large and diverse datasets to train on. The accuracy and reliability of AI's decisions depend on the quality, representativeness, and relevance of the data used for training. Biases or incomplete data can affect the performance of AI algorithms. Expertise and experience. Human clinicians possess years of education, training, and experience, which enable them to make complex clinical decisions based on a combination of scientific knowledge, patient history, physical examination, and intuition. AI may lack the ability to consider broader contextual factors or nuances that are not captured in the available data. Ethical and legal considerations. Clinical decision-making involves ethical and legal considerations, such as privacy, consent, and accountability. AI systems must adhere to these principles and be transparent, explainable, and accountable for their decisions. Ensuring the ethical use of AI in healthcare is an ongoing challenge. Collaboration and augmentation. The most promising approach is to view AI as a tool to assist healthcare professionals rather than replace them. By leveraging AI's capabilities to analyze data, identify patterns, and provide recommendations, clinicians can benefit from enhanced decision support, improved diagnostics, personalized treatment plans, and more efficient workflows. While AI has demonstrated impressive capabilities in certain clinical domains, such as medical imaging or diagnosis in specific conditions, it is unlikely to completely replace human clinicians. The ideal scenario is a symbiotic relationship between AI and healthcare professionals, where AI augments human decision-making by providing valuable insights and support, leading to more accurate and efficient clinical decisions.